All right, if dealing with all this, and thank you. If dealing with all this isn't enough, we have a pandemic. It's continuing, and it's continuing to take lives of Kentuckians. As an update, every Monday we start with Saturday, Sunday, and Monday's numbers and go through some of the rest. 2,308 new cases on Saturday, with 55 new deaths, with individuals as young as 38 years old. Sunday, 989 new cases, 37 new deaths. Again, losing Kentuckians in their 40s. 27-year-old man in Laurel County, so as young as in their 20s. Today, Monday, 1,089 new cases, which is actually less than last Monday. Now, it may potentially be that we're getting fewer tests from different regions with everything going on. We'll have to wait and see. 28 new deaths. Again, Kentuckians who are far too young on that list. Our positivity rate today is down just a little bit from where it's been at 8.78%. Still way too high, but we were above 9 and have now crept down a little bit. 1,253 Kentuckians in the hospital due to COVID, 315 in our ICUs, 181 fighting for their lives on a ventilator. All right, this last week, we actually almost exactly the same as the week before. If we can show the stair stepper chart, 5 fewer cases last week than the week before at 15,082 as compared to ultimately what was 15. I'm sorry, it's about 20 cases less than the week before. Again, it always takes a week or two to see if this is a trend. We were having a definite escalation. You know, the 3 bars from the back was Thanksgiving weekend. So if that had been a regular week, we would have had an escalation every single week until 2 weeks ago. We'll see what this means. Certainly, we are grateful that this week had fewer cases than the week before. I think it's still too early to determine if that might mean that cases are stabilizing or plateauing because, as you'll see in a minute, hospitalizations, ICUs, and ventilator use all going up. Let's look at the positivity rate. Actually, for the first time, and the positivity rate, it shows the continuous escalation with the Thanksgiving week not interrupted because the positivity rate isn't just the raw number, it's the percentage of positive tests down just a little bit last week versus the week before. If that holds, that is good news, but we are seeing the rest of the country escalate significantly. Now, not all the rest of the country had the huge surge that we most recently did, as you can see in that last surge that is going to be one of the most deadly in our pandemic experience. Let's show the line graph for hospitalizations, definitely on the rise again. Of course, the last major peak you see there is when our hospitals were overwhelmed, and we have not gotten back down to pre-surge from that last one, and now on the rise again. Do not have hospitals sounding the alarm yet, but everybody is watching this very, very closely. Our hospital capacity is now probably a little bit less than it was during the surge, the number of beds we can staff. However, we have had the experience in expanding ICUs and providing higher levels of care in places that normally do not do that. We have now solidified the connections between our nursing programs and these hospitals. I do believe we will be better prepared if these numbers continue to escalate. Kentuckians in the ICU also escalating. The slight tick down happens normally at the end of every single weekend. We'll see where it goes for the rest of the week. Kentuckians on a ventilator. Also, general trend increasing. How about some good news? We got a lot more people getting vaccinated. We have wanted to see that. Our numbers always come in the highest over the weekends, but we have some of the better numbers that we've had. 14,880 Kentuckians went in and got their first shot of hope. That means they decided to get vaccinated for the first time and got their first shot. 16,813 Kentuckians got their second shot to become fully vaccinated. And look at that next number. 46,373 got their booster shot. Remember, if it's been more than 6 months since your second shot of Pfizer or Moderna, or 2 months since J&J, you need a booster. That's how we avoid another surge. Waning immunity is real. We'll show it to you in some numbers in just a second. Make sure you get that booster shot. Not only does it give you the best shot against our enemy number one, which is the Delta variant, it looks like it's needed to protect you from Omicron. We go through this by every Monday by age demographic. Number one, mark is total Kentuckians that have gotten at least one shot has gone up a percentage point. We celebrate every time that happens. So let's see, today is the 13th. 2 days from now will be 1 year. No, tomorrow will be 1 year from the very first vaccine given out in Kentucky. And in that span of time, 1 year, we vaccinated 62% of every man, woman, and child in the Commonwealth of Kentucky. That's incredible. It's not enough based on what we face. That's never been done in human history. I'm really proud of our folks who are out there giving those vaccines. Now up to 2,731,731 Kentuckians that have gotten vaccinated. Our total for those that are eligible, 5 and up. These are people that can actually get a vaccine. Staying the same, about 65%. That's about 2/3. And then total 18 and up. These are people who make their own healthcare decisions, 73%. Folks, people in the Commonwealth overwhelmingly know that they need to get vaccinated, and people keep coming to get vaccinated. Every day, we have at least 1,000 Kentuckians who determine that it is time. Please, we're waiting for you. We want to see you. Come in, get protected. So we do the breakdown by age, 75 and up, unchanged, still at 91%. This is one we need to do better in. And 91%, you think, why would you need to do better than that? It's because they're at the most at risk. 65 to 74, these are our all-stars at 95%. 50 to 64 has gone up a percent, now at 79%. 40 to 49, this creeps up almost every week. This is my group and a group that's getting hit really hard in deaths right now from Delta, up a percent. Then we're the same all the way down to 12 to 15, up a percent to 45, and 5 to 11-year-olds, up a percent to 14. Let me talk about that for a minute. It does appear that many parents are waiting on the 5 to 11-year-olds that just opened up. It is safe. It provides protection for your child. It is a smaller dose. They even package it differently. My 11-year-old, our 11-year-old, Brittany and my 11-year-old, has gotten fully vaccinated now. I love her, both hers, more than life itself. And I would not have taken my own children to get vaccinated if I didn't not only believe, but know it is safe. Haven't done the racial demographics in a while. Top lines is it breaks down to about 81% of vaccinations, white Kentuckians, about 7% Black or African American Kentuckians. That's about 1% off the population numbers. But our other is still at about 10.1%, way above the census for any of our breakdowns. So still needing to dive in, and it's hard to have the information to the other to get an accurate figure. I actually imagine that would get us up closer to the breakdown in population of all our Kentuckians. Let's show the vaccination status of COVID-19 cases, hospitalization, and deaths. This is through December 8th. We would have done this on Thursday. Again, 82% of cases unvaccinated or only partially vaccinated, 84.7% of hospitalizations, and 82.7% of deaths. This has all been impacted by waning immunity. All these numbers were at or close or above to 90%. If you go out and get your booster, those numbers will go back to that place. But even without factoring in boosters, when we look at the rate of COVID-19 cases and vaccinations, you are still at least 4 times more protected even right now with Delta and waning immunity if you have gotten vaccinated versus if you have not.